Hello and welcome to Week 3, Health Policy and Population Health. This week, we're zooming out to the systems level, how policy decisions shape the health of entire populations. Population health looks beyond individual diagnoses and focuses on patterns and disparities across groups. Nurses are not just caregivers, they are powerful policy influencers. To advocate effectively, we need to understand how systems shape health outcomes. Population health is about collective outcomes, life expectancy, disease burden, access to care. It includes looking at the distribution of those outcomes, who is thriving and who is left behind. It also asks what structural conditions are driving this, rather than blaming individuals. How does your workplace track outcomes at the population level, or does it? SDOH are the root causes of most health outcomes: housing, income, education, food access, and more. These are upstream factors, meaning they shape health before a person even enters the clinic. Policy is a major tool for changing these conditions. So what policies have made the biggest impact on population health in the U.S.? The Affordable Care Act expanded insurance coverage and protected people with pre-existing conditions. Medicaid and Medicare are essential safety nets for low-income and older adults. But even with these, we still see major disparities, especially in states that didn't expand Medicaid. Have you worked with patients affected by lack of insurance or denied Medicaid? The World Health Organization sets global goals for equity, like reducing maternal deaths or eliminating health gaps. In the U.S., Healthy People 2030 outlines national objectives to improve health outcomes and reduce disparities. These frameworks are tools nurses can use to align care with broader justice goals. Let's apply this to a real-world nursing scenario, one that might feel familiar. Imagine you work in a rural clinic, and many of your patients don't have insurance. Your state is debating Medicaid expansion. You know that many of your patients could finally get coverage. How do you advocate? What data and stories could you use to support the change? What advocacy strategies could you realistically take in this situation? Nurses are trusted, skilled, and close to the problems, making us ideal advocates. Advocacy can happen in many forms: writing a letter, joining a committee, testifying, educating colleagues. You don't need to be in politics to influence policy. You just need to speak up with intention. One of the most powerful tools you already have: storytelling. Patient stories carry weight, especially when paired with data. Nurses can bring humanity into policy discussions that often feel abstract. Your daily experiences can inform changes in hospital policy, insurance reimbursement, or community funding. What story from your clinical experience could help highlight an equity issue? Which policy topics stood out to you this week? Medicaid, social determinants, or something else? How do policy decisions show up in your day-to-day practice, even subtly? What advocacy step, big or small, could you see yourself taking? Health happens where we live, learn, work, and play. Nurses are the bridge between policy and practice. Use your voice.